Hello and welcome to Let's Talk, a series of podcasts produced by the Hazel and Betty Ford Foundation on the issues that matter to us and the issues that we know matter to you. Substance use disorder, prevention, research, treatment, and recovery support. I'm your host, William Moyers, and this week, Let's Talk is on the road. We're here at the Betty Ford campus in Rancho Mirage, California, and we're joined by Matt Polacheck. Matt, welcome.
Thanks for having me.
Thanks for being here today. You had a little bit of a drive. You are our Director of Outpatient Services in West LA. Outpatient treatment, there was once upon a time we didn't talk about outpatient treatment. Why is outpatient now so important, Matt?
Well, to me, I think it was the missing link. And I think the shift happened when we really, looking at science, we looked at addiction as a chronic disease versus an acute disease. And so what happens is people go away and get treatment, and families and loved ones think they come back cured. Well, the bad news is we don't have a cure. But we've got good treatment, and the key really is, think of it kind of like landing a plane, and you want it to be smooth. And you go away for treatment a lot of times, and you come home, and your problems are still there. You still have all the issues that were there when you left, except for what you need really is support around you. Some people say the opposite of addiction is community. And what outpatient really is building a recovery community around someone so they can really go basically from an inpatient setting to a more self-management way of living their life.
Now, outpatient isn't for everybody, though.
Well, I think it really depends on the person and really how kind of acute the disease has gotten. And so I think the real key really is to have a good assessment and figure out really where you're at and your level of addiction. But some people do step in at an outpatient level, and some people need to detox first. The real key to that, to me, is really the medical model and understanding really medically, are you at risk if you were to stop and not be in a medical setting?
Why has outpatient become so important in the context of insurance coverage?
Well, I think that what our managed care partners have learned really is they want to limit reoccurrences, of a substance use disorder. And the problem really, like I said, is when you come home and you don't have that support system, your chances of having a reoccurrence go up. And so by kind of putting an emphasis on longer care, more chronic care versus acute care, we're going to have much better outcomes.
Well, outpatient isn't for everybody. We know that there are some people, I was one of those who needed residential treatment. How do you decide what level of care is appropriate for the patient?
Well, I think you really want to gather not just the patient, but stakeholders, family members, psychologists, doctors, and get input from everyone. Because as you know, there's a different side to every story. And so for me, I think, gathering as much information as possible. And then we really got to look at the substances. Certain substances people use, they can stop without any medical issues. And then you also have to realize whether we do need to separate that person from their dealer or from their drug of choice. Because some people have success stepping right into outpatient, and some need to really separate before they can be successful.
One of the advantages of outpatient is that the patient or the client can continue to work or continue to be a parent or continue to be active in the community, right?
Yeah, and the greatest kind of part of the reason I kind of got into this field is it's the only field I know in science where in 1 month to 2 months to 3 months you can see those relationships, really mend and get better. Addiction just shreds families, as you know. And so in outpatient, the greatest thing is having the patient come in their first day and 30 days later seeing them be present in their kid's life again, being able to go to their soccer games. And so I think that's the great part of outpatient is you can do the work, but you can also reintegrate into your community and then hopefully build another one, more supportive one.
I know one of your keen interests has been the stigma of addiction. And could a case be made that outpatient treatment actually helps to destigmatize the illness because the patient is still present and accounted for and around town?
I think so, and I think people like you, William, who are going out in the community and doing work like this is the most important because we're still struggling with this. I mean, we have the brain science now. You can see the brain scans and see how addiction plays its role in the brain. It's a chronic disease, yet people still think about addiction as a voluntary, moral, issue or someone volunteering to use substances. Yet we're talking about breast, other chronic diseases, whether it's cancer. You think about breast cancer. You think about the pink bracelet or someone running a 10K. When we think about addiction, we still think about someone with their needle in their arm. We've got to kind of reconceptualize this as a chronic brain disease and really start kind of getting people out there like yourself to really kind of educate the public.
Well, you too, you've been very passionate about it, and you've got that clinical piece that is as valid and resonates as loudly as somebody like me who might have been on that personal journey as well. Tell me, how did you get interested in this field?
Sometimes every story has a sad beginning, obviously. You know, and my family business was in jewelry, and so I was going to be go into the jewelry business. And I had a couple instances in college where I had a friend who drank, and he actually died from an alcohol-related car accident. And so it was that, and then I had another friend commit suicide who was also fighting addiction. And I literally, in my junior year of college, turned a sharp left from business to psychology, and went up and got into grad school in Berkeley and worked at the Salvation Army Rehab Center for a lot of years. And like I said earlier, just something resonates with the addiction, with addiction to me, the population, and to me it just seems like having to be part of an organization like this, our mission statement of hope and healing, and there's so much, I think the misconception is, everyone goes in relapses and all this stuff. There's over 20 million people in recovery in the United States, and it's a growing community, and there's so many great people out there and so many great communities in West LA. We've got our patients started hiking groups. I had a patient come up to me and say, I don't hike. And so I said, what do you do? He says, surf. I said, start a surfing group. So now they have a sober surfing group. And so we've got all these great recovery communities, for me to get to see the change from day 1 to day 30, 60, and years and years later, there's not a more rewarding field.
So we've talked about this before. Treatment is really only the beginning of the process, and you touched on it with aftercare groups or sober surfing groups or running groups or so on. What is the dynamic of? Tell us what recovery looks like down the road for people.
I think it's community-based, and I think that once we slowly destigmatize addiction and it becomes part of, and people understand it as a mainstream chronic disease, I see it shifting more towards, other chronic diseases, whether it's diabetes. There's no judgment or stigma on diabetes. I think one of the things that people, don't, when they look at other chronic diseases, all stuff like that starts, voluntary, having a high sugar diet or something along those lines, and then it becomes involuntary. And we have to accept the fact that that's part of the evolution of it. And so for me, I see community, becoming a big part of it, and I just see the lower the stigma goes down, and hopefully more, I'm a huge AA fan and just see the work that it does. But the one issue is we don't get a lot of people publicly coming out, and saying I've got an addiction. And so I'm hopeful that more people will come out, tell their story. There's nothing more powerful than hearing someone else's story. And we destigmatize it, it becomes part of our community. In West LA, we're seeing advantages and we're seeing that start to happen, but we've got a long way to go.
You talk about the stigma of addiction. There's also been a stigma for people in recovery who use medication as part of their regimen of recovery. I know at West LA we use our Core 12, which is, describe how you use it.
So I think that medication is an important component, and I think that was a missing piece. But really what we're looking at is comprehensive treatment. And I think the most important part is people understand that one size doesn't fit all. And so when we individualize treatment and we use medication as an aid towards that, for everyone it's different. For some people it's going to be a medication that's a blocker of opiates, such as Vivitrol. For some people it'll be Suboxone, which people are familiar with. But really it's individualizing treatment, and then more importantly, the Core 12 program is more about comprehensive treatment. So it's using that as a piece of it, but really surrounding person with coping skills, with good CBT, with good treatment plus community. So it's one small piece to the puzzle.
Is Core 12 applied differently in a residential setting than it would be, say, in the outpatient in LA?
So similar to in an inpatient in Hazelden Betty Ford, we have our specific Core 12 groups. But it's also very similar in the sense of kind of the key really, again, is taking a patient and pushing them towards self-management of a chronic disease. And so it's very similar in that way. The treatment, the great part about having all the centers across the United States is we can step people down, they stay in the continuum, they stay with a lot of patients they're with, and also we can communicate really well with each other. And so the treatment kind of has like I said earlier about landing a plane, a much smoother process.
Not long ago, you had some really significant interactions with the United States Surgeon General. Tell us about that.
Yeah, I went up north to do a town hall in Seattle, and I got to sit down and chat with him for a few minutes. I think that the conversation, we talked about MAT treatment, we talked about opioids, and some of the interesting things we discussed is, right now we've got a pretty significant fatality issue in the United States with fentanyl. But in 2016, 40% of opioid-related overdoses were from prescription opioids. So I think the world, right now the news is all fentanyl, 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 which is a serious crisis, and we need to get under control. But we still have a prescription opioid use issue. And so I think, we talked about balancing that out. We talked about this idea of more comprehensive treatment, and then again, stigma and advocacy and all the work you do.
We've seen so much attention paid to the opioid epidemic, rightly so. 70,000 people will die of overdoses in the United States this year, and a majority of them will be because of opioids. But you see it in West LA. People come in with all kinds of addiction to lots of substances, right?
Yeah, and most opioid users are actually polysubstance users.
Oh, interesting.
And so I think that, unfortunately, the difference with the opioids, I feel like, is with most substances, it goes, this is kind of Psych 101, but it goes from a positive reinforcement to a negative reinforcement, meaning most people start using drugs adding on to something, positive in their life to enhance something, and then it becomes a negative reinforcement. They're doing it to avoid a withdrawal, or they're doing it to avoid pain in their life. Opioids are different. Opioids normally start off as a negative reinforcement because you have chronic pain or you're prescribed it. And so they're a little different. But at West LA, we see a lot of alcohol use disorder, opioid use disorder. But a lot of patients we have are polysubstance, unfortunately.
Where is marijuana in that universe of substances? I mean, I can't remember. I should know this, but I can't remember if marijuana is legal in California. It is.
It's legal in California. We're seeing an increase, and the scariest part to me is we've got great new brain studies on how the brain is still developing, up until your mid-20s to late 20s. And we're seeing a lot of young adults coming in with marijuana addiction. And obviously,
You mean you can get addicted to marijuana?
That's why you're here. That's why, and I'm thankful for the work you do, is that you're out there spreading the word because, I think, let alone the THC levels are so much higher now, we're seeing families destroyed every day by marijuana. Destroyed. I mean, this is not your grandparents' marijuana to begin with.
Right. And what about alcohol? Where is it in the scheme of things?
Well, alcohol is just the problem we just can't get over, I feel like. And I still think, the percentage of people that we treat are still alcohol use disorder, unfortunately. Being someone that, thinks the access to drugs and alcohol can be, it becomes easier and easier with the internet and with all this stuff. Alcohol is the easiest drug to access, and for our patients in the outpatient, the challenge, and that's why community is so important, is it's everywhere. And I don't have any studies to back up that alcohol use is increasing, but we are seeing increases in a lot of other substances.
You talked about community being so important. I think there's no doubt that our outpatient, wherever it is, and whomever's outpatient is an integral part of the community, and it allows the patient and the patient's family to still be part of that community without having to go away for treatment.
Yeah, and support. I think that's the biggest problem. People, it's important to go away to treatment, but the support people can get at home, and then really figuring out who is not supportive, and weeding out the old people and bringing in people that are healthy in your life. But we can't do this alone. We can't fight addiction alone. We need people around us. We need support. We've got a family group every Wednesday night that started in a small room, and then it went to a bigger room, and now we have to do multiple times a week family group because these are families getting brought back together. They need support around them. They need loved ones, and this is not a disease you can fight alone.
You're propagating there in West LA. You're propagating the antidote to addiction, which is community, which is the first word of the first step of those 12 steps that many people have taken. Matt Polacheck, thank you very much for giving us that sense of community that manifests itself there in the outpatient facility in West LA. Thanks for joining us today.
Thanks for having me.
And thanks to all of you, our loyal listeners and viewers, to Let's Talk. On behalf of our executive producer, Lisa Stangl, and that great crew at Blue Moon Productions, I'm your host, William Moyers. We'll see you again.